Comprehensive Guide to Shockwave Therapy for Foot Pain. Today, I'm going to give you a comprehensive guide to using shockwave therapy for your foot pain. First, if you've never heard of shockwave, I'm going to give you a little background. What is shockwave? Shockwave is a type of regenerative medicine that uses sound waves that are given at a therapeutic dose to your foot to stimulate your own body's healing system. It's kind of like a defibrillator for your body's healing system. But how does it work? High power energy is applied to sound waves or electrical waves that penetrate your injured tissue to help restart the healing process. Many times, if you have pain for 3 to 6 months, it becomes chronic and can stall. This is because much of the tissue in the foot is fascia, ligament, and tendon that has poor circulation. And continuous walking on the foot can slow healing. Basically, you don't heal it fast enough before it's injured again. How often are the treatments for shockwave? Treatments are usually weekly, but you can go for 2 weeks between the treatments. Like going to the gym, though, there's little benefit to going only once a month, and more frequent treatments are better spaced out treatments. Who cannot have shockwave therapy? Those with cancer in the treatment area should not be treated. What can be treated? The most common areas are soft tissue injuries. This can include plantar fasciitis, Achilles tendonitis, pain to the front of the foot, and tendon issues such as peroneal and posterior tibial tendon. And I want to review an example of a patient with very tight calves. She had a connection or adhesions between the muscles. We did 3 sessions of shockwave along with deep tissue massage work on her own, and she felt much better in the follow-up. The next most common area is bone injuries. This can include something called bone marrow edema, fractures that are slow to heal, and sesamoid bones that are slow to heal after a fracture. I had a patient with a 5th metatarsal fracture who was an avid athlete and needed to get back quicker to her sports, and we were able to speed up the recovery time by 1 to 2 weeks. And in some particular areas that can be treated with shockwave include neuromas and arthritis. Now, these are unique situations and can help reduce the amount of cortisone that's typically short-lasting. And shockwave treatment is essential because most patients don't know shockwave is an option and can be safer than surgery and longer lasting than cortisone injection. I use this treatment daily in my office, and it's almost like doing surgery without surgery. For me, it's the first-line treatment for all my patients. Many patients think that surgery is the last resort for their foot condition. If you feel this way, I would recommend seeing a doctor who has access to shockwave therapy. I'm going to include a few resources on shockwave therapy under this video if you want to learn more. And if you live in Massachusetts, I'd be happy to see you in the office and see if you're a good candidate for shockwave therapy. Click the link under the video to learn more.